Hey, it's Brooklyn, your favorite women's health nurse practitioner student, and today I'm going to be giving you 6 tips to help you navigate through your next healthcare appointment. Isn't it annoying when you have this doctor's appointment or just this healthcare appointment and they tell you to come 15 minutes early, and then you come 15 minutes early and then they don't see you for 30 to 45 minutes after your appointment time? Okay, so first off, I want you to think about and write down any questions that you have beforehand. You sit in the waiting room and you might be sitting there 5 or 10 minutes, and then they call you back, they do your vital signs, height, weight, all that good stuff, ask you a couple of questions, and then they either put you back in the waiting room or they take you back to your actual patient room. And then you wait and wait and wait. And so when the doctor, nurse practitioner, PA, whoever comes, when the healthcare provider comes in and sees you, you almost sometimes feel like you're being rushed. They're asking you a lot of questions back to back to back to back to back. And sometimes you're so annoyed because you've been waiting for so long that you can't really get your questions out. You can't really answer their questions. And it's just like a complete chaotic event. So first, I want you to, before your appointment, I want you to think about and write down any questions that you may have. Now, this may be any questions you have about your current health issues, any questions you have about any chronic health conditions you have going on, any questions you might have about the medication that you're currently taking. I know some of us do a little Google research, go to, take a couple of courses in Google University to self-diagnose and then make ourselves crazy before we even get to the appointment. But it can be helpful, and it can guide you into asking certain questions that you may or may not have thought of beforehand. So just write your questions down that you may have for your healthcare provider, so that when they say, "What questions do you have?" you already can just knock them out. Second, I want you to ask your most embarrassing, most uncomfortable questions first. And that beginning of the appointment is usually when you have your healthcare providers usually undivided attention. They're less distracted. They're not necessarily thinking about the next patient or what else they have going on in the day. So those first few minutes that you have with them, go ahead and ask your most concerning questions, your most embarrassing questions, your most just the questions that are super pressing to you. Go ahead and ask them first, because that's when they're sitting down, they're facing you, they're not doing any assessments on you, they're not charting, they're not typing, they're not writing things down, they're just you and them. And you just want to make sure that you both have each other's undivided attention and ask those questions so you can go ahead and get that uncomfortableness out the way. And you definitely don't want to ask these questions when they're like, "Hey, do you have any?" I personally am like, "Hey, do you have any questions?" Sometimes when I'm at the door, hand on the knob, I'll ask again, "Do you have any questions? What questions do you have?" That is the worst time to say, "Yeah, I do have a question." And I have tons of patients who, when I get to the door, they're like, "Oh, one more thing." Or just in my nursing days, the doctor, nurse practitioner, whoever, the healthcare provider walks out, and then I'm doing discharge paperwork, and then I say, "Hey, do you have any questions?" And they have a gang of questions because they didn't understand what was going on with the interaction between the healthcare provider. They're not really sure what they were talking about, or they may just have they may just have additional questions. So just make sure that when they got their hand on the door, that is not the time to be asking questions. Number 3, be honest with your healthcare provider. Listen, we have seen a lot of things. We have heard a lot of things. We have touched a lot of things. We have smelt a lot of things. Listen, there's very little that you can do that can stump us. When you stump us, we have colleagues that we can ask. There's references for us to look up. So we need you, in order for us to help you, we need you to help us help you. So whatever symptoms you have, whatever, discharge, smells, whatever is going on, when we ask you these questions, we do need you to be honest, because your honesty allows us to treat you better. And so, trust is a two-way street in healthcare. And I know that the Black community, myself included, have a history of mistrust, distrust, not trusting the healthcare system. We definitely have reason to not trust. But we just sometimes don't trust the healthcare system, and sometimes the healthcare system doesn't trust us. When we say we're having certain symptoms, the providers aren't listening. When we're saying that certain things are happening, we're feeling, seeing, smelling, tasting, whatever, when things are not normal, we just don't feel right. Honey, you know your body more than anybody else. So when you tell your healthcare provider something's going on, you don't feel right, and they don't believe you or they don't take you seriously, then that definitely causes a rift in the trust, that causes distrust, and then it's kind of like, "You don't believe me, I don't trust you, what are we doing here?" So we're going to ask you a lot of questions. We're going to ask your health history, what's currently going on with you. We're going to ask your health history, any medications you're taking, medications, legal and illegal, drugs, alcohol, tobacco. Like, if you, depending on what type of provider it is, like me as a women's healthcare nurse practitioner, I will be asking you about your sexual history when it's necessary. And so we need you to be honest with us so we can help you get better. LMP, or last menstrual period. So we do want to know the first day of your last period. We want to rule out pregnancy or confirm a pregnancy. Depending on your age, we would want to know if you're approaching menopause, if you're in perimenopause, if you're in full-blown menopause. And then it's just certain medications, if you're pregnant, you can't take. And we just need to know, certain things can affect the hormones in your body, and we just need to know. And also, certain contraceptives can be used and cannot be used at certain times of the menstrual cycle. So we're just trying to see what our options are. So that is something that you would need to keep track of. So just whenever, just pop it on your calendar, use a tracker, whatever you have to do. But just know that when you come, we're gonna ask you when's the first day of your last menstrual period. Number 5, I want you to understand your treatment options. I am currently a women's health nurse practitioner student, of course, and I don't believe that everything has to be fixed with a pill. And so when you're dealing with your healthcare provider, when you come to, and when they come to a diagnosis and they offer you treatment, make sure they go over the risks of the treatment, of having the treatment and not having the treatment. Make sure they go over the benefits of having the treatment and not having the treatment. And if there are any alternatives, whether it's an alternative medicine, whether it's an alternative like an herb or something, sometimes we do that. So you just want to make sure that you understand what your risks and benefits and alternatives are, whether it's surgical option. And if you're not liking what you're hearing, or if you guys can't come to an agreement on a plan, you always have the option to get a second opinion, a third opinion, however many opinions you need to get, because this is your body. Your treatment option is a shared decision-making process. So you both should be agreeing on what your treatment is. And number 6, keep your appointment. There's so many things that could go wrong in the 12 months that you see your healthcare provider. If you're fairly healthy and you don't necessarily need to go see the healthcare provider for anything, then when we see you once a year, we need to see you once a year. Like, there's certain labs we need to get done. There's certain exams we need to do. And especially, we're getting older, so there's certain things that we need to be checking to make sure that you're okay. So just make sure that you're keeping your appointment, and you're making your appointments, and you're going to your appointment. All right, so I hope these tips to help you navigate your next visit with your healthcare provider were helpful. Remember, we want you to think about and write down all the questions that you have. I want you to ask the embarrassing and uncomfortable questions first. I want you to be honest with your healthcare provider. I want you to know the first day of your last menstrual period. I want you to understand your treatment options and have the provider go over the risk, benefits, alternatives, and all of that. And I want you to make and keep that appointment. If you made it this far, thank you for watching. Don't forget to like this video, subscribe to my channel, and comment below if I missed anything or if anything was helpful. See you in the next video.